It's BIMA's first time at Wow Digital. Really happy to be here, and thanks for having us. I feel a little bit unfamiliar with all the funky music that doesn't usually go with insurance. When the organizers invited us to do a presentation, they mentioned that we were in the category mobile and entertainment. And I said, well, I'm not sure about you, but I don't think insurance is really that fun. But we're here to talk about insurance and how it works with mobile. Why is insurance important in the markets we operate in? We operate in emerging countries, developing countries. Emerging Asia is a part of it, a part of what we do. And a lot of people in the countries we operate in, they're living below certain income levels. They look very different from developed economies. And we also have a situation where you have employment being largely self-employment or employment in informal sectors. What this means is that there's the absence of formal employee benefits, stuff that you would be used to in major cities or in major economies. And you have a lot of people living in high-risk environments. They are working as laborers, where they are more exposed to accidents, for example. They are living in areas which are potentially have a higher frequency of outbreaks of disease, sickness, and they don't have very good access to facilities, healthcare or otherwise. And what this all sums up to is that there's really a lack of financial resilience. You have many people still remaining unbanked or underbanked, and they don't have very good access to savings or even basic forms of credit at an affordable price anyways. And insurance, in our view, is a tool. It's a tool that can actually help to address all these sorts of problems. It can help to build resilience, and in the case of risk events, helps to prevent families and individuals living in this particular part of the world, living in these particular segments, from falling back into poverty cycles. But insurance is difficult to get it out to the market that we just spoke of. And why is that? On the consumer side, you have issues with affordability. Products are not really designed for them, within their reach. And you have issues with literacy and awareness. People don't really understand how this all works. It's this unfamiliar, intangible concept. You don't really get something. You don't get a box with it. And even when they do understand it, they don't really trust it. How can this possibly be true? Will the insurance company pay me and my family when something happens? Can I trust them to? I've heard so many stories that I can't trust them. And on the supply side, you have issues with scalability. Today, you don't really have cost-effective forms or channels of distribution. The traditional insurance industry thrives on agents and brokers. The guy in a suit, the guy in a tie who takes you out for coffee, takes you out for lunch, explains to you why financial planning is important for you and your family. You can't afford to do that for the segment of people we just spoke about. And you don't have a payment channel. How do you usually pay for insurance? You have a bank account, you hook it up with a standing order, or you have a credit card, and you do, again, a recurring payment or deduction of your credit card bill. Now we're talking about markets and customers who don't have bank accounts. We're talking about individuals and households who don't have credit or even debit cards. How do you facilitate the collection of premium? How do you allow them to pay for insurance premiums? And this is where mobile comes in. Everybody here, I think, is aware of mobile penetration. And I think there were lots of fancy slides earlier about now adoption of smartphones as well. But if you look at the insurance world, the insurance industry measures penetration in their parlance, a percentage of GDP per cap. We're not really interested about that. We're actually interested in population penetration. And population penetration is actually really, really low in developing markets. Insurance, where it is being adopted and taken up by consumers, tends to be concentrated in the middle or upper middle classes, in the hands of the very few. But there is a massive opportunity here. I mean, if you look across the developing markets, we believe there's around 4 billion people today who are uninsured or underinsured. And mobile is a platform that can address that gap. That's a $40 billion opportunity if you believe that you can collect minimally $10 in premium from each of these persons in a year. That's not a lot of money, but sum of all of it together, it starts to become quite meaningful. So who is BIMA and what have we done? So we showed up on the scene around 5 years ago. A lot of us came from the mobile world. Some of us came from the insurance world. We're a little bit in between. We're not really an insurance company. We partner insurance companies. But we sit in between. We're an intermediary. We act like sometimes I call it a broker plus plus. What we have done differently from the traditional broker is to enable insurance companies to bring insurance into the hands of the underbanked through mobile technology. And this has allowed us to solve two of the problems I mentioned earlier on the supply side. On distribution, we're now able to use mobile to completely transform the process. We started 5 years ago. Smartphones weren't that big of a thing back then. So we started with SMS and USSD interfaces. We took paper out of the entire enrollment process. You don't need to sign a policy form. You can do it all on SMS or USSD. It's really easy. It takes you less than 2 minutes to get through the process. You do it entirely on your own handset, or if you need some assistance, someone will help you. Your mobile number, your MSISDN, that's now a unique policy number for you. And you can use it to prompt a response back to our systems to act as a digital form of signature. On an ongoing basis, every month, sometimes every week and every day if you need to, we transmit information, we disseminate information back to you via SMS, and that's your policy, really. Anytime you want to find out, you have questions about your terms and conditions, your exclusions, or your cover levels, you just have to ping us on your SMS and USSD, and it's all there. Payment. What do? We partner at the telcos. We allow customers to use their prepaid airtime credit as a means of paying insurance premiums. So they don't have a bank account, they don't have a credit card, but they all have a phone. And they're all topping up their phones every day, every week, every month. Some of the balance they used to use for voice, some of the balance they used to use for SMS, now of course mobile data. Now they park some of the balance for insurance premiums. We downsize the premiums to levels which make that possible. So they pay around $1 to $1.50 a month. We give them the opportunity to adopt sachet pricing. I don't know if everyone is familiar with the term sachet pricing. It came from this idea that you could sell shampoo in sachets instead of bottles. So instead of only compelling a customer to pay their monthly insurance premiums of $1 to $1.50 at one shot, we gave them the opportunity to break that down into even smaller amounts. So in a single day, maybe they pay only 10 cents. And they get to make that payment in 15 installments over the course of a month. And we configured algorithms on our billing platform to work with the telco's own billing platforms to make this all possible. But that's still not enough. Because earlier on I said there's supply side problems, but there are also consumer side problems, right? So we solved the distribution and we solved the payment problem with technology. But then we still have an issue with customers not really understanding how this all works and not really trusting how this all works. So what did we do? It's a bit odd to be talking about this at an event called Wild Digital. But we had to use an analog hack. So we deployed an analog last mile. We continue to use human interactions, agents, These are our employees. They're operating in various emerging market environments on the pictures that you see on the screen. They take the time to explain how insurance works. They are the face to the insurance. For many of our customers who are, for the very first time, hearing about this as a product, for the very first time, listening and being educated about why financial resilience is important. We have 4,000 of these guys today operating across our various markets. And it works. So in the last 5 years, we have sold 27 million policies. Life insurance, health insurance, accident insurance. Every month, we're selling 500,000 policies. Most of our customers, 75% of them, are hearing about insurance for the very first time. 93% of them live under a $10 a day poverty line. We operate today in 16 countries across Africa, Latin America, and Asia. We partner major telecoms groups. We're partners with Millicom International, operating under the name Tigo. We're partnering Digicel in the Caribbean and in the Pacific. And we're partnering Axiata, who got us a ticket to this event today. Sorry, it's not. Okay. I can't search. Sorry. But that's still not enough. Well, and why is that not enough? In the insurance world, there's a saying, insurance needs to be sold, not bought. I think what you've heard earlier, our combination of using mobile with an analog hack, is a victim of that maxim. There's still an element of it that needs to be sold, that education, breaking down those barriers. There's still an element of that at play. But we don't believe that that maxim is unbreakable. We want to break that. We want to turn insurance into something that's bought, not sold. So what are we doing? We are redefining the value proposition of insurance. And one of those first things that we're doing to do that is to incorporate mHealth, mobile health, as part of the value proposition. What you see on the screen here is a first prototype of a smartphone application that we call Dr. BIMA. It allows you to access a range of healthcare services using a smartphone, using an app that includes also health insurance. So there's a complete journey. What's that journey? When you're feeling well and fine, you can subscribe to push content. For example, nutrition or fitness. Keeps you healthy. When you're not feeling well, you push a button on the app, and it gives you access to teleconsultation with a doctor of ours. If need be, the doctor can issue a prescription via SMS. You can take that prescription to a partner pharmacy of ours, and you can get a discount at that pharmacy. If you're not feeling well enough to go to the pharmacy, you can request for the medicine to be delivered to your doorstep. Cash on delivery for payment. If you're really unwell, you have to go see a doctor face-to-face. You go to a clinic, a partner of ours, or a hospital, and you incur expenses. What happens there? Your expenses are reimbursed via your health insurance, purchased through BIMA. This is live in Pakistan today, in Lahore. This is real. This is happening. And we hope to bring this to many, many more places in the markets that we operate in. And that's all I have today. Thank you.